After 15 years, Dr. Heather Austin's time as a P.E.I. family doctor is coming to an end. She's made the decision to leave in the summer of 2028. A big reason for Austin's departure.
The Physician Services Agreement is an excellent document. The problem came when Health P.E.I. started to try and implement that document.
The agreement took effect last year, but after pushback, the Medical Society, the province, and Health P.E.I. entered mediation over guidelines for family doctors' workload. A memorandum of understanding between the three parties was announced in December and allowed some to have fewer patients. But Dr. Austin says there is a problem with that model.
We've been told by Health P.E.I. that the first year of this new agreement is information gathering. I've expressed, and a number of my colleagues have as well, that gathering the information is a distraction and a problem for us because it's, again, administrative work that's taking us away from time we could be spending taking care of our patients.
That's because of the way the time spent on administrative tasks is counted. Dr. Austin says that she spends on average 2 to 3 hours a day doing administrative work. That can include ordering tests, following up on consult letters, and filling out forms. And all of that has made it harder for her to do the work she loves to do.
For me, it's been the lack of accountability from Health P.E.I., the approach that they have had in trying to manage the physician group, in not feeling heard. And really this has been an ongoing cycle where things get bad, you feel like things might improve, and then they don't. And I just reached the point where I can't go through that cycle again.
Dr. Austin says her decision to leave P.E.I. is final, but she hopes it might lead to change, and says the province needs to bring all parties back to the table to reach an agreement that works for everyone. Taylor O'Brien, CBC News, Charlottetown.
We asked Health P.E.I. for an interview. It provided a statement saying to strengthen collaboration, the Health P.E.I. board is establishing an advisory panel to hear directly from primary care providers. Health P.E.I. is working under the agreement approved by the Medical Society of P.E.I. and respects its role representing physicians while continuing to listen and improve how the agreement is implemented. Our top priority is improving timely access to primary care for Islanders. P.E.I.'s opposition party leaders say this is a pivotal point for healthcare and say the agreement with physicians needs to be re-evaluated. Sheehan Desjardins has more reaction.
P.E.I.'s opposition parties are calling on government to bring everyone back to the drawing board and revisit the agreement in place with family physicians. The party leaders worry if nothing changes, more doctors will decide to go too.
Through all manner, doctors are reaching out to me and saying that they're leaving or they're going to be leaving, and we're seeing that happening now. So it's not alarmist. Unfortunately it's reality, and I just really wish that we had a government right now that would listen to what the doctors are saying.
He says he's hearing from lots of concerned Islanders as well, about 100 in the last few days. With 3 doctors leaving, around 4,500 people could end up on the lengthy patient registry. Matt McFarland says he plans to bring this up when the legislature resumes at the end of March, but is hoping a solution will be in place already.
My hope right now is that this government listens to Islanders and walks this back and sits and has meaningful discussions with doctors to try and get things straightened away, because we are heading down a very, very bad path right now.
The leader of P.E.I.'s Liberal Party says healthcare is broken in this province. Now is the time to build it back up stronger.
There are many that look like they want to leave P.E.I. We can't have that happen. We have to have that discussion with them to ensure they stay here, but we also need to listen. I'm not sure that listening has been very effective as of late. We have to hear their message and then work with that to make sure that changes are made.
The Minister of Health and Wellness was not made available for an interview, but did send a statement that said they are reviewing the matters raised and determining the appropriate steps to move this work forward. And they will continue working with Health P.E.I. and physicians to ensure they're building a sustainable healthcare system for both patients and the professionals who care for them. Sheehan Desjardins, CBC News, Charlottetown.
For more on Dr. Heather Austin's story and the reaction to her and other doctors' departures, you can always visit our website. That's cbc.ca/PEI.